Hello, and thank you for joining us for the 16th Annual Barbara Donaho Distinguished Leadership and Learning Award. I am Versie Johnson Mallard, Dean of Kent State University College of Nursing. We appreciate your support as we recognize these hardworking and dedicated nurse preceptors who are this year's award recipients. We are honoring our hardworking and inspiring preceptors who work for our valued healthcare partners at hospitals, clinics, health networks, private medical practice, and public agencies. Precepting nursing students is not an easy task. It is an enormous responsibility and critically important to the development of our future nurses. We are so grateful to have this opportunity to recognize the significant contributions made by so many nurses to the next generation of nursing professionals. Thank you also to the students who thought so highly of their preceptors that they took the time to nominate these individuals for the Donaho Award. Now, I would like to tell you a little about the woman who inspired this award. Barbara Donaho is a longtime friend of Kent State University and the College of Nursing. A summary of her credentials and honors include: she is a distinguished alum of Johns Hopkins School of Nursing, holds degrees in nursing education and administration from the University of Chicago, as well as an honorary doctorate of law from Kent State University. She's a graduate of the Johnson & Johnson Wharton Fellows Program in Management for Nurses. She is a former commissioner of the Joint Commission on Accreditation of Healthcare Organizations. Most recently, she served as president and CEO of Anthony's Healthcare Center in St. Petersburg, Florida. Over the years, Barbara Donaho has been an endless source of support for innovation, teaching tools for the College of Nursing, specifically for our simulation lab and for simulation development. Her vision, leadership, and support has made it possible for the College of Nursing to recognize more than 340 outstanding preceptors who have made a significant impact on our students and the future nurse leaders. Please join me in celebrating Barbara Donaho.
Hello, I'm Barbara Donaho. When I graduated from Johns Hopkins School of Nursing with my nursing degree, my dream was to work in pediatrics. I accepted a position at Akron Children's Hospital, where I was a practicing nurse for 2.5 years. I then went on to attend the University of Chicago, where I obtained my master's degree in nursing education and administration. For more than 55 years, I dedicated my life's work to the advancement of the nursing profession as an educator, lecturer, director of nursing, and senior vice president of patient services. In 2002, while serving as the Kent State University College of Nursing Advisory Chair, the college committee desired a way to recognize the healthcare professionals, especially nurses in Northeast Ohio, who mentored our nursing students in hospitals and other healthcare facilities. We felt it was important to publicly recognize these individuals for the time and energy they devoted to helping prepare our nursing students for their future careers. It truly amazes me how many individuals we have already recognized, and I'm excited thinking about those who will receive this acknowledgement in the future. It is an honor to have this award share my name. During these celebrations, I have always loved visiting with and meeting each honoree. Every award recipient has inspired our students and helped to foster a deeper love of the nursing profession. Mentors also played an important part in my professional career, so following their example, I too have tried to help with the next generation of nurses thrive in their field. Congratulations to this year's Barbara Donaho Distinguished Leadership in Learning Award recipient. We are most appreciative of the kindness and dedication you have shown our Kent State students. Thank you.
Thank you, Barbara, for your remarks. Now, I would like to introduce our Mistress of Ceremonies, Kent State College of Nursing Professor, Mary Cutchin.
And now, the 2022 Donaho Award recipients. Sarah Ball. Sarah has truly been an inspiration. I saw firsthand why she is probably the most popular PNP at the practice. She is fun and makes great eye contact with the kids. She gets down to their level, knows every cartoon character, type of train, Marvel hero, TikTok sensation, popular bloggers, and all things gaming. She uses that knowledge to make her connections, and of course, her smile makes you feel at ease. When I am a PNP, I endeavor to be just like her. Service with a smile, go the extra mile, talk directly to the kids, involve them in their exams. It is hard to talk to kids at times, and with Sarah, I learned valuable techniques to increase my comfort level. Nominated by Melissa Singh, MSN student. Lenka Bowman. Lenka has been the rock in my final semester of my senior year. She has made me feel beyond comfortable in asking questions, even if I think they are dumb questions. She has helped me go from a nursing student to a future nurse. Not only can I comfortably take on a patient from start to finish in their care, but I can comfortably take care of 3 patients from start to finish. Lenka also took time to help me study for the NCLEX, which is going above and beyond what she signed up for as a preceptor. No matter what kind of day we are having, Lenka has nothing but love and compassion for every single one of her patients. She has mentored me to think about more than just a diagnosis. She requires me to dig deeper into the problem. Nominated by Tiffy Moen, BSN student. Linda Bolt. Linda was my preceptor for my very first clinical experience as a graduate student in the FNP program. She has a warm and welcoming presence. With her comprehensive experience, she has provided me with guidance and education across many areas of nursing. Linda has been precepting students for the last several years and will even take on more than one student at a time during the semester. With each patient, she provides me with education on assessing, interventions, and care. One of the most admirable traits that Linda has is the way she interacts with her patients. She does not spend the encounter looking at a computer screen, but instead she looks at her patient. I have noticed her patients are incredibly grateful for her, and often she will see a patient's entire family. I could not ask for a more patient and guiding preceptor for my first clinical experience. Nominated by Amanda Hudak, MSN student. Kim Brayman. Kim was always a nurse I could turn to when I was confused, and I took comfort in asking her questions. She gave me every opportunity to enhance my learning experience. Kim allowed me to be very hands-on, as she discovered that was how I learned best. She made sure that I fully understood all testing and that I felt comfortable performing it before I entered each room. Kim does not stop. She never cuts corners and always puts her patients before herself. I have never met a more driven, honest, and trustworthy nurse. I am so proud I'll get to be a nurse just like her one day. Nominated by Chloe Ramnarine, BSN student. Keith Cavey. On my first day of clinical, Keith provided me with valuable resources that have already advanced my learning experience and will be beneficial to me when I graduate. Each week, we brief and debrief by going over our plan for that day and for the next week so that I feel prepared. We have discussions before and after each patient appointment so that I can evaluate my therapeutic and pharmacological interventions and my treatment plans. Keith provides me with suggestions to advance my knowledge and skills. In addition, we build on knowledge that I gain each week by increasing my involvement in the interviews. Keith always allows time for me to ask questions. Instead of giving me the answer to a question about a medication, he will ask me to explain my thought process and provide feedback that pushes me to think critically. Nominated by Brittany Janko, MSN student. Natalie Klein. Natalie Klein was my first ever clinical instructor. I had a lot of self-doubt and wondered if this field would accept a quiet-natured person such as myself. Throughout the semester, Natalie helped me find my love of nursing again and told me I could do this. She helped me break out of my shell by giving me opportunities in clinical. Her guidance helped to push me out of my comfort zone and try things I never thought I would accomplish. I left that semester with much more confidence and skills in the nursing field. She is the best role model to her students of what a nurse should be. Natalie was an amazing mentor. Nominated by Samantha Wagner, BSN student. Andrew Dane. Andy made me feel comfortable and is one of the team members from day one. He showed how he hadn't forgotten how it was to be a nursing student, learning how to think and act like a nurse while learning. He set a calm learning environment. When I did make a mistake or have a blunder, I was able to learn how to do it correctly the next time. I was able to learn and grow through my practicum experience on Andy's unit. Hospice and palliative care takes special nurses to work there. Andy is respectful, empathetic, genuinely cares for the patient and their family during the patient's end of life. Nominated by Stephanie Hayslip, Accelerated BSN student. Sydney English. Sydney was my clinical preceptor for my senior year practicum experience. She helped make this experience not only a great learning opportunity, but also something I enjoyed doing. Sydney showed me how to not be afraid to take charge of a situation, as well as how to be confident in the skills I have. She demonstrated techniques and then allowed me to practice them on my own, which was helpful in building my confidence. I applied to work in that emergency department because of Sydney and how awesome she was with me. Nominated by Virginia Olszewski, BSN student. Allison Figler. Allison allowed us to get the most out of our learning. She corrected us in a respectful way and gave us tips on how to improve. Whenever the opportunity presented itself in clinical to use this situation as a learning experience, Allison was quick to put it into context. Not only did she tell us how to do things, but she also explained why they were important to the bigger picture. This is priceless skill to have in the nursing profession. The knowledge and experience I gained while under her watchful eye will carry me through the rest of my time as a nursing student. It will set me up to be a positive role model for the rest of my peers. Allison helped me become excited to learn and improve my skills. Nominated by Taylor Ellman, BSN student, and Jordan Welsh, BSN student. Aubrey Gilliam. Aubrey made my practicum experience amazing. She took the time to explain tests and procedures. Aubrey was willing to teach me subjects I did not know much about and took the time to thoroughly explain how care works in the pediatric emergency department. She tried to find something new for me to learn. She would print out information sheets for me for the diagnosis of my patients to review for my knowledge and quizzed me on the information to make sure I was retaining it. Aubrey has greatly impacted my learning experience. Nominated by Kayla Toth, BSN student. Callan Gregson. Before I was placed with Callan, I had a different preceptor. I had to unexpectedly get a new preceptor, and Callan was so enthusiastic and welcoming. She was very knowledgeable and taught me time management, medication administration, and everything in between. Callan has made such an impact on me during the short time we have been together, and that inspired me to apply to work on the floor where she works. I am happy to say that I did, and in fact accept a position there, and I am very excited to start. Callan has gone above and beyond and has become such a role model to me. I have gained so much knowledge during my time with Callan, and I have no doubts that she will continue to help shape me into an amazing nurse. Nominated by Taylor Leisure, Accelerated BSN student. Jennifer Hiscox. Jen has helped build my confidence in my care for patients and helped me feel ready to care for patients on my own once I graduate. She always took the time to answer my questions and walked me through things when I was unsure. Jen has shown me how to be professional and therapeutic in the language I use with patients. She has also taught me to communicate professionally with other healthcare professionals and improve my patient education. Jen is an excellent nurse whose patients love and appreciate her. She introduced me to the nurse manager on her floor who interviewed me. I was offered a position. I'm excited to continue to learn and grow in my role as a nurse. Nominated by Alexandria Begot, BSN student. Dr. Denise Hecht Hewitt. Dr. Hewitt has been my preceptor for 2 semesters during my graduate studies. She is very knowledgeable and resourceful. She makes learning effortless by the way she provides information. Dr. Hewitt is very organized, dedicated, and thorough as a provider. Nominated by Zipporah Asiago, MSN student. Sarah Johnstone. Sarah has been extremely patient, flexible, and informative while working with me. She has taught me skills I had not yet had the ability to practice. Most importantly, she has done it in a way that has increased my confidence tenfold. Sarah has also taught me about priority care. She asked me questions and provided scenarios for us to discuss. Sarah always found something positive in the care, skills, and decisions I made regarding our patients. If there was a better way, she didn't hesitate to let me know in a respectful, knowledgeable way that let me feel smarter, wiser, and more confident. When I started my practicum with her, I felt unsure if I would have what it took to work as a nurse in a med-surg unit. Now I am considering taking a position as a float for those departments. Nominated by Rachel Stedman, BSN student. Kayla Kish. Kayla has made my experience in my senior level practicum so meaningful and impactful. She has truly taught me so much, and I look forward to going to my practicum because I'm excited to see all the new things I will learn. Kayla has given me so much encouragement and confidence in my nursing ability. She pushed me to do things she knew I was capable, even if I didn't have the confidence myself. I was very nervous to be a newly graduated nurse, but I truly feel just being paired with Kayla has given me so much confidence in my abilities. She was so helpful, and I was so comfortable working with her. Kayla is the perfect example of an outstanding nurse, and I felt so lucky to have her as my preceptor. Nominated by Rachel Ra, Accelerated BSN student. Ashley Kovac. Ashley has impacted my nursing through sharing her compassion and knowledge, and I was grateful to have her as my preceptor. Having completed my practicum with Ashley, I feel extremely prepared for my future career. She treated each patient, staff member, other students with kindness and empathy. She treated me with respect and never made me feel less than her. Ashley was the same in and out of the patient's room, which showed her authenticity. She took leadership on the unit when necessary and was always willing to fill in the gaps. Ashley role modeled teamwork and helping others. She used each situation as a teaching and reflective learning experience to help me improve. Her nursing skills and kind personality shined through to her patients, and each one was grateful to have her. Nominated by Hannah Taylor, BSN student. Janine Kukoklik. Janine was not originally my preceptor, but decided to take me on after my original preceptor could not. She welcomed me and never made me feel like a burden. Janine encouraged my learning experience by creating a safe environment where I could ask questions and ask for help when needed. She encouraged me to think critically and to be confident in my abilities. Janine not only took the role of preceptor, but she was also usually charge nurse. I think she deserves this award because she always went out of her way to make sure I learned as much as possible. She took on the assignment load and charge nurse responsibilities at the same time. She encouraged me to use my skills and lead by example. Nominated by Cherise Smith, BSN student. Melanie McCrum. Melanie made sure I felt welcomed into the unit and kept me engaged by asking me questions to ensure I understood the teaching. This enhanced my learning of the patient's condition and why they were receiving certain medications and treatments. Melanie assigned tasks to me that would give me hands-on experience and independence to assess the patients using my knowledge and skills. She reviewed my assessments with me and provided a thorough feedback that helped me reflect on and highlight areas for improvement. Melanie emphasized that it is so important that we as nurses give compassionate care to those who are suffering. She embraced my cultural differences and provided an environment where I felt safe and welcome. Nominated by Jennifer Christian, BSN student. Yvonne Moon. Yvonne has been my manager, mentor, and preceptor at various times throughout my career path. Currently, she is my preceptor as I work through my final semester in my MSN MBA journey. Not only has she provided the guidance required of a nursing preceptor, but she has also mentored and advanced my understanding of nursing leadership, management, and professionalism. Her guidance aids in the success of both sides of my career path and offers perspective both in nursing leadership and healthcare management. Her drive and perseverance in the pursuit of positive outcomes for patients and the hospital, even in the face of overwhelming challenges, is something I hope to emulate. I am honored to have had the opportunity to observe and learn from Yvonne. Her impact on our profession and my career are immeasurable. Nominated by Dave DePofi, MSN student. Jessica Rundle. This was Jessica's first time precepting, and she has been so thoughtful and taught me so much about the unit and nursing. Jessica showed me what it is like to be an advocate for all patients and to work with the care team to help the newborns we are taking care of. She helped me advance my time management skills and learn skills to stay on task if a distraction does come up. Jessica has helped me become a more comfortable nurse in the intensive care unit environment. I have learned so much about neonatal patients from Jessica, and I am eager to learn more. Jessica created a positive atmosphere where I felt comfortable asking questions and developing new skills. Jessica has made such a positive impact on my time as a nursing student, and she is a nurse I will always look up to. Nominated by Rachel Potter, BSN student. Cecilia Spinn. Cecilia made every day I spent with her enjoyable. Seeing how amazing she was with our patients inspired me. It's not easy taking care of patients who are living their life with cancer. It takes a special person to be able to celebrate good news with one patient and turn around to give support to a patient who may be having a hard time coping with their diagnosis. She has pushed me to want to become that special kind of person too. She allowed me to do everything within my scope of practice to improve my skills. Cecilia was always willing to answer any questions I had and encouraged me. She helped me boost my confidence as a nurse. Nominated by Jeanette Russell, BSN student. Heather Taylor. Heather is an outstanding preceptor and mentor. She has made my practicum experience incredible. I have learned so much from Heather. She guided me through our day, including assessments, discharges, medication administration, teaching, and more. If we were finished with what we needed to do and there was another learning opportunity, Heather encouraged me to go observe. Afterwards, we would talk about what I saw so I could better understand it. Any questions I had, Heather answered them without hesitation. I have learned and accomplished so much already. I hope to work on this postpartum floor post-graduation. Nominated by Ashley Gulling, BSN student. Leslie Todd. Leslie went out of her way throughout my clinical to make sure I had the best experience. She asked other nurses, doctors, and CRNAs if I could observe different procedures. She was so nice and had a positive attitude. Leslie explained to me different situations she has experienced as a nurse and how I could handle them. I felt safe to ask a lot of questions, which allowed me to get the best experience possible. She deserves to be recognized for her kind heart and being such a great nurse. Nominated by Michaela Bell, BSN student. Alexandria Ewer. From an internal perspective, Alex was the recognized go-to person. Her peers have a lot of respect for her and her knowledge. From an external perspective, she cares deeply for every one of her patients and acts appropriately for each circumstance. Alex doesn't get worked up in stressful situations such as staffing issues. Above average number of patients, rapid calls, or even code calls. She's cool as a cucumber, and I can only hope to emulate her professionalism. Nominated by Carla Hoffer, Accelerated BSN student. Kristen Whitesell. Kristen Whitesell was my clinical preceptor for my general med-surg class this past fall semester. She routinely tested and revised her approaches to facilitate our different learning styles and needs. She was a great cheerleader when I was nervous, and she was dedicated to helping us feel knowledgeable and capable prior to skill exercises with patients. My levels of competence and confidence grew substantially under her care and prepared me well for my subsequent clinical experiences. Nominated by Ginger Bowles, BSN student. Terry Whitfield. Terry was not only a great nurse, but an exceptional preceptor. She went above and beyond to provide me with opportunities that challenged me to think critically and problem solve. Terry promoted an environment where I felt comfortable admitting things I didn't know. She provided positive feedback and constructive feedback. Terry allowed me to grow tremendously as a person, student, professional, and student nurse. Because of Terry, I have developed a love for learning as well as a love for educating others. I know in 20 years I will be using what Terry taught me, and I will smile remembering how big of an impact she has had on me as a person and as a nurse. Nominated by Grace Tonkovich, BSN student. Morgan Williams. I was nervous to begin my clinical hours at a level 1 trauma center. However, after meeting Morgan, my fears were immediately put to rest. She was welcoming, confident, and willing to share her experiences and knowledge with me. Morgan is incredibly competent in her care of trauma patients. Her level of focus and concern are consistent regardless of the acuity of the patient. Morgan is a breath of fresh air and has reminded me that there are providers who truly care about the well-being of their patients and will demonstrate all good things in the workplace. I will be forever grateful for my time with Morgan and for the knowledge she has given me, as well as the motivation to keep doing things right. I would love to end up working in trauma, but I am confident that no matter where I end up, I will take so much away from my clinical time with her. Nominated by Alyssa Fawcett, MSN student. Lisa Willoughby. Lisa instilled a sense of confidence in me that allowed me to believe in myself. She was a patient, straightforward, and most of all, she defended my presence and advocated for my education when others were not quite so receptive. She would consistently work with me on areas I needed to improve in, and we always made our short time together count. I learned so much from her, and I am grateful for the opportunities she sought out for me to learn. We worked one-on-one together, and she provided constructive criticism when needed and gave insight on how the nursing world worked. Not only was she a phenomenal preceptor, I gained a friend and a nurse I could ask a million questions to without hesitation. It is because of her that I found my passion for emergency nursing. Nominated by Jillian Lemeister, BSN student. Kaylin Wines. Kaylin has only been my preceptor for a short period of time, but I have already learned so many vital nursing skills from her. She is a great advocate for her patients and a great coworker to her peers. Kaylin has given me so many experiences to learn and grow as a nurse. She explained things well and does not judge when I make a mistake. Kaylin has shown me how to be a leader and how to stand out as a nurse. Kaylin does not cut corners and does everything very thoroughly. She has demonstrated to me the true colors of nursing. Kaylin has pushed me to come out of my shell, and overall, I feel I am a better nurse because of her. Nominated by Samantha Scott, BSN student. Sandra Yoder. Sandra is an incredible preceptor. She provided me with numerous opportunities to gain experience and pushed me to achieve maximum independence. She encouraged me to think critically in order to determine the most appropriate interventions for our patients based on the situations at hand. Sandra is a nurse I look up to and will strive to be like once I graduate. She has incredible bedside manner, and all her patients adore her. She is in tune with quality improvement and providing high quality and safe nursing care. She provided me with significant and valuable knowledge that I will take with me as I continue my nursing journey. My experience with Sandra is one I will never forget. I will forever be grateful for this opportunity. Nominated by Shannon Kendrick, BSN student. Congratulations to this year's award recipients of the Donaho Award.
Thank you, Mary. Before we conclude, I would like to tell you about an opportunity we provide our preceptors to show our appreciation. The college has created Precept Ed, a unique program to say thank you and show our deep appreciation for preceptors. Developed exclusively for Kent State nurse preceptors, Precept Ed is an online CE activities library that offers preceptors free continuing education credits to help them meet biannual licensure requirements. Within this program, preceptors can save their activity progress, allowing them to come back later and pick up where they left off. Completion certificates can be downloaded from the website whenever they are needed. Finally, preceptors will be able to filter activities by subject, allowing them to find activities most relevant to their practice. Please visit nursing.kent.edu/precepted to sign up. I would like to thank all our clinical partners for making it possible for their nursing professionals to act as preceptors. Your support is critical to the College of Nursing and to our nursing students. Thank you, and congratulations again to our 2022 Barbara Donaho Distinguished Leadership and Learning Award recipients.